So diabetics can get something called diabetic retinopathy, and retinopathy meaning retina. And so in the back of your eye you have the retina, which is kind of like the wallpaper on the inside of a room. And so that retina can become damaged over time after having diabetes for several years. And the way it looks, what it looks like to us on examination, is you can actually get bleeding in the retina, scarring, and swelling due to high blood sugar and diabetes that's uncontrolled over long periods of time. There's several symptoms you'll get, and the first symptom typically is you'll get a slight blur in your vision, and this can be due to the swelling and or bleeding in the back of the eye. Other symptoms you may get is in some patients they can acutely lose vision, where suddenly within seconds or minutes your vision can go from good to bad, and that's because you can get bleeding in the middle of the eye. The causes of any diabetic retinopathy or bleeding in the eye is due to long-standing uncontrolled glucose being too high. And so what happens is the eye becomes ischemic, or there's a lack of blood flow to it because of the high blood sugar. And then what happens with that is, due to the lack of blood flow, the tissues can swell, and then you can also get bleeding inside the eye due to chemical markers that are in the eye that make new blood vessels that bleed. Really, any diabetic's at risk of getting diabetic retinopathy, and that's why we recommend an annual exam for all diabetics to get screened for this process. And it is a condition that can change from 1 year to the other. So again, all diabetics should be getting a dilated retinal examination once a year. Patients with diabetic retinopathy are diagnosed with a dilated examination. So we're able to look at the back of the eye, the retina, and we physically see the changes occurring in the retina. We can see spots of blood, swelling, and even a buildup of white cholesterol in the retina. Other tests that help diagnose changes from diabetic retinopathy is the OCT, or the ocular coherence tomography, which is analogous or similar to getting an MRI of your eyeball. Treatment for diabetic retinopathy begins with tight control of blood sugar. So that's the initial treatment, and long-term, that's the long-term goal for patients, because if left untreated, the sugar, regardless of what we do in the clinic, you will continue to get changes in the retina. Once you have diabetic retinopathy, there are focal treatments that we can do in the eye clinic that can help make the swelling and the bleeding get better. There are several different treatments, and the initial treatment is usually a laser in the eye that helps prevent or reduce the swelling in the eye and can help prevent or make the bleeding stop. The other treatments are where we can put a medication inside the eye that actually helps the swelling go away and the blood vessels go away as well. Most patients with diabetic retinopathy typically do quite well as long as they do their part, which is diet, exercise, and controlling your blood sugar. So most patients who actually do their part and control their sugar or glucose in a good way typically will not lose vision over long periods of time. In those patients who do have the changes occur, the treatment is available to help prevent it from getting worse. So in choosing a physician to help treat your diabetic retinopathy, again, you'd want to make sure this is a physician who's dilating your eyes once a year, at least. You'd want to make sure they have the latest equipment too, as well, to check the retina. As I discussed earlier, an OCT, or ocular coherence tomography, which is the standard of care in checking for swelling and bleeding in the back of the eye.